Alright, so I want to do a little postpartum video or just go into more detail about my labor and delivery and everything, and because the other video I had to cut kind of short because she was getting a little fussy. So as soon as she was born at 10, well, going into labor with that epidural, it was that's what I wanted. But I was always open minded because I didn't know what I was getting myself into as like a first time mom and not knowing exactly what to expect. But once everything went so fast and I didn't really have an option after a while, I kind of just had to put up with the pain. Going through the contractions where I had to push, those were really painful. Like the sensation was so great and strong that actually push, and I had to resist it. I couldn't. At first, I was fighting it, like I said, and the nurse taught me how to resist it by rocking, and that helped. But that was just probably the most painful part. Pushing to me wasn't that hard because you were just basically really giving into that sensation. So it's like it was almost a relief, and me personally, I felt great because I could actually feel what I was doing. So when the doctors and nurses were like, "Yeah, push just like that," they were really coaching me and like really telling me, "Push just like that. You got it, just like that." And I would try to remember how I was pushing and do it like that each time because I knew I didn't want to push for a really long time. I wanted to push as and get it over with. And so I did about 5 sets of pushing. Three pushes per contraction. So I did about 5 sets. So that's what I'm saying. My total push time was probably about 15 to 20 minutes. I mean 10 to 15 minutes, I think. It wasn't long. Yeah, and then the most painful part about pushing was kind of when she was just right, like I think after her head came out and she, it's like she was there, but he left her there for a second. I guess the suction, all that kind of hurt. But then all of a sudden she was out, and I saw her and she was all, not pale, but the color from being inside and all, and took her a while for get her blood flowing and all that through her whole body. And that was great. That was amazing. My boyfriend cut the umbilical cord. I thought he was gonna chicken out, but he cut it. And yeah, so she was born on the 31st, New Year's Eve at 10:40 a.m. and she was 7 pounds 10 ounces. And right after she came out, I felt normal. Like I just felt fine. Even when I was pushing in between pushes, I felt fine because the contractions had went away and I was waiting for the next contraction to come to push. But I felt almost 100%, and he was and I thought that the afterbirth, like the placenta, I thought that was gonna hurt, and it didn't hurt. It was actually just, it didn't hurt at all. He kind of just pulled it right out. I didn't have to push or anything, and I thought it was gonna just be a little painful, uncomfortable, but no, it wasn't. Um, he did give me like a little stitch because he said it was a skid. I don't really know what that is. He said it wasn't really a tear, but it was just, he was just gonna stitch it up with one stitch. He said it was he had to put a catheter in so he didn't accidentally stitch up my like urinary tract. He had to make sure he didn't stitch that up, so he put a catheter in. He gave me a shot to numb me for the stitch, but I felt the shot and I felt the stitch, so it seemed a little irrelevant. And but yeah, so he gave me the stitch, and the stitch hurt. That was painful, but other than that, it wasn't excruciating. I was shaking a little bit, not like not really bad shaking, but I could feel my body and my legs shaking. Sorry, she's in her pack and play, and she was spinning up, and I don't know how to video edit, so sorry about that. But yeah, so I felt 100%. After that, only the worst part was that I felt so icky, from like everything that was going on and bleeding and all that stuff. I felt a little icky, but that kind of went away after the first day. The After having the baby, after having Brooke, the worst pain I felt like in the exact stitch area. I felt a little pain right there. The rest of everything felt fine, and they gave me 800 Motrin, and that went away. And so I felt great. I was just like, this is beyond my wildest dreams because I feel so back to normal, and everything's fine. After the baby, even though I was really tired when I was going through labor and before I had to push, after she came, I was wide awake. I guess it was the adrenaline or whatever, or endorphins, and I didn't go to sleep that whole day. I went to sleep that night, and of course I was tired and had to wake up and feed her. But that was that was cool, I guess, kind of. But I didn't go to sleep. I guess I was like on a natural high. And and let me think. Breastfeeding was good. Um, excuse me. She latches on great. Breastfeeding's going great now. The biggest problem in the beginning was that she would be so sleepy. She would fall asleep. I had to keep like touching her cheek or kind of like wiggling my nipple to keep her engaged. But she does good. She does good. She doesn't eat a lot right now. She eats like 10-minute sessions per feeding, and that can be from like 2 to 4 hours. I kind of feed her on demand, but they say she's fine, and that's fine. The nurses and everybody said it's fine. When we left the hospital on Saturday afternoon, she weighed 7 pounds 3 ounces, but I'm sure since then she has gained weight. And let me think. Everything goes good. She sleeps so much during the day, and she sleep right now. I know. I should be sleeping now. They say you should sleep when the baby sleeps, but she just sleeps so much. I'll be sleeping all day if I slept when she slept. So I'm not gonna do that. But at night, Al he usually wakes up to stay with. He wakes up and keeps her occupied and everything, unless she has to be fed or burped, and I do that. We take turns changing her, and then that's basically how the routine has been going the past 2 days. He'll wake up to be with her, and I'll just feed her and burp her. So I get a lot of rest during the night. I guess he wants to do his part because I'm with her all during the day. And I'm trying to see if I'm covering everything. She has to go to the doctor this week, of course. They wanted me to schedule it for Monday, but the doctor I really want to go to, they're all booked up, kind of, because I'm not booked up, but they just have a high volume. So I'm trying to get in. I'm gonna get in by the end of the week because she has to go when she's awake. But yeah, they really want me to go on Monday or Tuesday. But it's all gonna work out. Okay, so that's all I have for now. I don't ever write stuff down, so I'm kind of scatterbrained when I do these videos. Um, I think I have gone over most things I want to talk about as far as after the baby was born and life after having her and how I felt and everything. And yeah, questions please. And I will probably do a video after her 1 week appointment. All right, bye.